What exactly is homeopathy? A system of medicine? What exactly is homeopathy? I'm asking you a little bit. You hear just about everything and anything about it. And for many people, you'll get answers like, it's an alternative medicine, it's a gentle medicine, it's a medicine for treating minor ailments, it's a medicine that cures it's a plant-based medicine, or even it's just a placebo. We could respond to all these so-called definitions, of course, one by one, but I prefer to get straight to the heart of the matter. I'll go into more detail later if necessary, and I believe it is, with a short episode about the concept of placebo. And to tell you the absolute truth, if you clearly and thoroughly understand Samuel Hahnemann's profound discoveries as they are meticulously presented in his seminal work, The Organon of the Medical Art, you should then be able to easily and comprehensively explain what exactly is homeopathy and how does it fundamentally operate. There was a great practitioner, British, named Margaret Tyler, who wrote an absolutely remarkable article titled How Not to Do It, meaning how not to do it. And it's true that quite often it's easier to define something by what it is not than to actually explain what it is. So indeed, homeopathy is none of the things I have just listed. In that case, what is left to say about homeopathy? Well, homeopathy is very simple, and I know I'm going to make a lot of friends by saying this. It is the only way if you want to bring about healing in a patient. We'll also agree in a moment on what we mean by healing. Conventional medicine, if you look closely, also has results. So, as mentioned, here I'm going to talk about medicine in terms of healing, whether it's from an acute infectious episode, for example, or the successful treatment of chronic diseases with the idea of restoring health. When I say that, you understand where I'm going with this. Beyond its ability to restore, for example, a functional heart, if you've had a major hemorrhage, beyond the capacity of surgery, which has made extraordinary advances, we end up back at square one when it comes to medicine. Everyone in conventional medicine feels entitled to do whatever they want, or rather, to follow the protocols dictated by the industry. If we want to talk about healing, we'll have to address the fundamental concept of health level. Health levels, somehow you'll understand that even though the question is never raised in medicine, you can't compare the health level of a young individual who maybe just has a few patches of eczema with that of another person who is bedridden with multiple sclerosis, and so on. You can therefore classify health levels according to the depth of the pathology in the body. I'm trying to keep things as simple as possible here. Conventional medicine, when it acts through its chemical methods, will prevent the appearance of symptoms, and by preventing symptoms from appearing, it will worsen the energy level, it will decrease it, it will worsen the patient's overall condition, so that patients will begin to present more and more physical symptoms, increasingly deeper ones if you prefer, affecting organs that are progressively deeper. And then, after a while, and obviously depending on the unique makeup of each individual, we end up seeing the development of symptoms in the emotional sphere, such as anxiety, depression, phobias, and suicidal thoughts. When this is no longer enough to contain the pathology, the body begins to attack the mental plane, notably with the development of mental illnesses, which have become increasingly common today in the Western world. And of course, all of this is linked to the consumption of chemical products. So, homeopathy, if there is a medical system, Hahnemann clearly defined the therapeutic ideal. In Latin, it is said cito, tutto et jucunde, that is to say, it is fast, it is complete, and it is beautifully done. In no way does this correspond to the definition of conventional medicine, which is ugly, expensive, arbitrary, toxic, and does not bring any improvement in the level of health. You see, I am proceeding step by step by showing you what homeopathy is not. If we go a little further, we will realize that the very notion of healing, if it can still exist, since the word to heal has been relegated to the dustbin reserved for charlatans, this word heal implies by the very definition of levels of health an improvement in the level of internal energy so that the symptoms no longer have any reason to exist. So you see, the difference is that it's no longer about intervening directly on a mechanism that produces a symptom in order to inhibit it, which would only further degrade the level of health. The only rational way to proceed is to provide energy to a suffering patient so that this influx of additional energy will allow the body to produce symptoms on increasingly superficial levels. So you see that we are really describing two radically opposed phenomena. That is the absolute ideal. How can it be achieved? Well, the first thing is to look at the patient, not just the diseased organ. And here again, Once more, we have to break another preconceived idea to shatter old paradigms to move away from the industrial world and its standardized treatments. Medicine was ultimately created by people who also built cars. For them, there's the guy who puts on the doors, the guy who installs the windshield, the guy who puts on the wheels, and they see you as if you were just an assembly of inert organs, which is obviously completely absurd. The reality is that you might be consulting for a particular problem, but that problem is something you and the doctor have arbitrarily decided to focus on today. Because in reality, you have a whole host of symptoms that exist at the same time, but today you've chosen not to pay attention to them. In fact, this is what we call a totality. This totality of symptoms persists. It is always there. So, you understand that there is a problem. You cannot address a phenomenon that affects a totality by trying to treat this or that symptom unilaterally. In my step-by-step approach today to help you understand homeopathy, you can see that we are coming to the necessity of looking at things from the right perspective. In short, a model that is false cannot produce correct results. A false model is like representing the earth as flat and motionless, with the sky and everything else revolving around it. Well, it cannot give you good results. Here is the same thing. What I'm proposing to you is a complete change of perspective, precisely with the aim of establishing healing, that is, a return to a previous state, and not a process that would involve taking some magical substance, as conventional medicine likes to set trends, the new drug, the new hope, the new thing, which is nothing more than a promotion for a product whose toxicity is known from the very first minute, but which will be exploited to make billions. In reality, as soon as there is a totality, we realize that this particular whole presented by the patient, this particular set of symptoms, behaves like a unique code that belongs to him alone. He has a set of symptoms that characterizes him and distinguishes him from every other person on earth. From there, I'm going to tell you a truism, but it's important to keep it in mind. You can well imagine that all these people exhibiting so many different diseases cannot be treated in any other way than with a treatment that is exactly tailored to them. So, with my little line of reasoning, I am gradually trying to pull you out of the current dominant chemical industrial paradigm to get you to consider that, okay, there is a totality. Now that we are faced with this totality, with this whole, how do we begin to consider a treatment? To start answering this question, how is it that a certain medication given to a certain person did them a lot of good? Surprisingly, in fact. And how do we explain that the same treatment given to someone else only made things considerably worse for them? They tolerated it very poorly. Why? When you start thinking like this and asking these kinds of questions, you will need to provide concrete answers. Only homeopathy is truly capable of providing you with those answers. The reality is that every substance is itself capable of carrying and producing a group, or more precisely, a totality of symptoms that belong to it. That is to say, every substance is capable of generating an artificial illness in an organism that is unique to it, and which will manifest, of course, according to the various susceptibilities of the people who experience it. And this artificial medicinal pathology can, in turn, be characterized by the totality it is capable of producing. Here, I would like to emphasize a rather surprising aspect of things. Homeopathy requires giving up reductionism. Reductionism in biology will certainly not bring us anything good. We break things down into small pieces. That worked with the inanimate world. It made it possible to develop magnificent atomic bombs, which the Americans had fun with, but it does not help us make progress in understanding biology with a view to healing. Fortunately, healing follows laws that belong to our level of observation, that is, the level of symptoms, whether they are objective, subjective, or observed by those around us. We do not know how these symptoms are generated. It's actually impossible to know. There are far too many cells that make up the human body, and far too many mechanisms within each cell to claim to understand what is happening. Conversely, substances themselves can cause artificial diseases without us ever being able to determine the precise mechanism of the process. Of course, we have an idea of the main pathways. We can know if a certain drug is capable of acting on the vagus nerve or on another system in the body, but we cannot go beyond that. All we can recognize is that only the symptoms are able to indirectly characterize the internal disorder that produces these symptoms. In short, it's as if we had the image on a stamp, the reversed image. That's how we can get an idea. So what I'm trying to express to you is this notion of the encounter between two totalities. That is to say, conventional medicine likes excessive simplifications. It likes the notion of bijection. It likes the idea that a germ causes a disease, that a drug treats only one thing, and so on. It's a completely unsuitable view that is no longer valid, that should no longer be valid, yet it's still constantly taught. We need to move away from this bijective notion that links 2 points together. It's infinitely more complex. It's multidimensional, meaning that in the phenomenon of treatment, you actually have the interaction between a three-dimensional form, so to speak, of the medication, capable of creating certain symptoms over time and within a certain volume of space, together with a unique set of characteristics that define the patient and their own totality. From there, you understand that if I can use the example of my 2 hands, which together have 10 fingers, to keep it simple, most of the time, you'll have a substance that might be suitable for 1 or 2 symptoms, but everything else is not appropriate. What you need to understand is that, once again, what we arbitrarily call the side effects of a medication, which we have to admit is completely unrealistic in an approach that claims to be scientific, to label as side effects the effects of drugs we don't want to acknowledge, when in reality these side effects are nothing more than the rest of the drug's activity manifested in the body. You will also note in passing that the only way to know the properties of drugs is to test them on healthy volunteers to see how they become ill after taking them. Which, by the way, also gives you an idea of the altruistic and humanistic dimension of homeopathic medicine, since by experimenting on ourselves as humans, we can determine the properties of medicines without needing to kill animals or conduct abominable battery tests, and thanks to this acquired knowledge, we can in turn treat animals as well as plants. But I will close this parenthesis. So, at this point, you actually realize that, I dare say, the equations described by Hahnemann in the Organon, these equations describe how to manage these interactions of pathologies or totalities, which can be either dissimilar or to a certain degree similar. It's the only way we have to compare these entities, which I remind you are multidimensional. This multidimensional entity of the patient, which is characterized by this totality of symptoms, begins to interact with the drug, which itself is capable of presenting another multidimensional entity. So, once again, it's an extreme oversimplification for me to just use 10 fingers with 2 planes interacting. You have to imagine that this is something that probably goes beyond 3 dimensions in the interaction. We're a long way from just take your Tylenol and go to bed. And so Hahnemann showed very clearly that in nature these occurrences are rare, since the patient's pathology must coincide with the natural pathology that it can present. That is to say, a patient, for example, who had chronic orchitis, a chronic inflammation of the testicle, there are numerous cases in the allopathic literature of the time showing that if this same person contracts mumps, the orchitis disappears. There are a multitude of such cases, and when I say a multitude, Hahnemann, I believe, even goes so far as to cite just under 1,000 of them. These examples, too, should have caught the attention of those who wanted to make use of that marvelous creation, our brain. And if chronic orchitis is cured by mumps, it is very likely because mumps has the ability to cause orchitis as its main complication when it occurs. Hahnemann himself calls these examples heroic, meaning, as you can imagine, that we do not have enough infectious, even epidemic natural diseases to be able to mimic most of the illnesses people present with. Therefore, we need to find a different pharmacopoeia. That's why we turn to plants, or the animal world, or the mineral world. We theoretically have an infinite number of substances at our disposal. From then on, Hahnemann showed that the process is universal, and that when there is no compatibility between the forms of the patient's totality and the totality of the drug, well, it doesn't work. That's what is called allopathy. And that's why, when I was telling you why a medication helped one person but on the contrary made things considerably worse for another, it's actually because there was simply an interaction between 2 totalities. The totality of one of the 2 cases, purely by chance, was compatible with the totality of the drug that was administered, whereas the totality of the other patient was incompatible with the totality of the drug that was given. And once again, you realize that whether we practice non-homeopathy blindly or homeopathy blindly, in every case, it's a world of the blind. And that the only way to have a path that leads toward healing is to open your eyes and ask, okay, what happens when I have 2 totalities that resemble each other from a certain degree of similarity? This degree of similarity will be defined by a fundamental concept that was established by Dr. Granier, who wrote wonderful works on homeopathy. He was French, and homeopathicity will qualify the degree of similarity between a drug and the symptoms of the case. The higher the homeopathicity, the greater the chances that this interaction will ultimately destroy both entities that are similar. In fact, what I have just defined for you in a single word, the law of similars, is that two disorders that resemble each other in their manifestations mutually destroy one another. And conversely, when two disorders that do not resemble each other in their manifestations meet, they will interact with each other. Sometimes one of the two disorders is monstrously more powerful, and in that case, it will supplant the old one, literally pour a layer of concrete over it, suppressing it. This is what happens when, after a year of treatment, your symptoms eventually disappear because you have so saturated the body with allopathic drugs that you have inflicted an artificial medicinal disease on the body, which has supplanted and suppressed the original one. But in no case do you truly achieve complete healing. Sometimes when the opposing forces are quite comparable, you ultimately end up with a rather strange and unusual situation where the entire body is divided. One of the regions of the body will be able to continue existing with a certain group of symptoms, while another will be dominated by the symptoms of the drug you continue to administer. And in no case will you be in the zone where the destruction of both occurs through similarity. When this similarity through a high degree of homeopathicity exists, then something happens that is hard to grasp, because for the past 10 or 100,000 years, we have been used to administering drugs that are not homeopathic, that do not resemble the case. And in that case, you are constantly forced to increase the doses and to switch, if you see what I mean. When you have the homeopathic substance, then the organism reacts in an absolutely incredibly sensitive way to the substance that resembles its state. It's as if the presence of these symptoms in the organism expresses what one might call an idiosyncrasy, a natural sensitivity to the substance that is itself capable of provoking such a set of symptoms. And then, and Hahnemann realized this very quickly, phenomena of aggravation occur that are absolutely unbearable. And that's probably why, in the history of thinkers, we almost have proof that Hippocrates may have followed this same path, but very quickly, everyone ran into the problem that you end up facing an aggravation that is phenomenal, because indeed there is a kind of addition of the natural disease and the artificial disease, which at first will combine before destroying each other, and you end up facing terrible aggravations. And it is this that led Hahnemann to fragment the quantity in order to always administer less. And again, it was clinical practice, and only clinical practice, that dictated to Hahnemann the need to keep fractionating further. And this is what was Hahnemann's fundamental discovery, which allowed for yet another revolution within the revolution. Understanding that even though we have reactions and chemical mechanisms that govern us, for example, if I move a toe, it's because there is a whole set of electromagnetic commands, chemical processes, and then muscle contractions. Hahnemann showed that this process he had discovered by chance. Dilution by shaking, dilution, shaking, dilution, shaking. He, who was a distinguished chemist, let me remind you that he maintained an important correspondence, a significant exchange of letters with Lavoisier, who was dismissed by the Revolution. Well, he was the first to know that on paper there could no longer be any trace of the original substance. Yet the organism continued to react to it. And so Hahnemann, here, without knowing it, revealed a completely unknown and neglected dimension of the phenomenon of living beings, which is based on phenomena that are probably non-chemical and energetic in nature. He calls this dynamic. It's such an enormous revolution that 200 years ago, you can imagine the impact it must have had on his contemporaries. And even today, in eras that consider themselves enlightened, every time we try to talk about dynamic processes, we are always seen as crazy. And so homeopathy shows us that if the dynamized substance is able to act on a receptive organism, it's because we're no longer dealing with a question of dose and quantity, but rather in a world where similarity causes the two things, the two natural and artificial entities, to attract and destroy each other. And this is a phenomenon, a mechanism that does not rely on a material mechanism. In other words, Hahnemann writes, with a still phenomenal advance over our time, that the unpleasant phenomena we call diseases are nothing more than a disruption of vital energy. In other words, we're talking about wavelength without actually saying it. We're entering a world that is no longer that of chemistry, but of physics. And if an ordinary mother sees her child fall and come back with a big bump, gives him a simple globule of arnica 30CH, and that globule makes the bump disappear before her eyes within 15 minutes, this single observation destroys the entire allopathic way of thinking. We need to be wary of these simple facts that don't fit with the accepted theory and are actually the entry point for turning everything upside down. This was the problem with classical physics at the time when black body radiation led to equations that were clearly wrong, with radiation that would be infinite. It was necessary to accept that radiation was quantum in nature, not linear and not continuous. Well, all of that started from this one tiny observation. Who cared about black body radiation anyway? Well, it ended up turning all of physics completely upside down. Well, this simple little bump treated with arnica 30, which has no existence on paper, and yet works so wonderfully on something involving a lesion with bleeding, bruising, a bump, and the bump visibly goes down, this throws all of medicine into question. And our entire understanding of biological mechanisms and of living things falls apart. We will be forced to, and obviously the years and centuries that follow what I say today will only reinforce what I have just told you. Life is an intertwining of electromagnetic and chemical phenomena. Today is not the time for me to go into detail on the subject and talk about the chaotic phenomena that are at the very foundation of the mechanisms of life. And it is precisely because life is a process of a chaotic nature, in the mathematical sense of the term of course, that the slightest influence, when it is appropriate and perceived, can have an immense impact. It's the story of the famous butterfly that flaps its wings in Singapore and causes a storm in Canada. That's roughly the idea. Now, I hope that through this very brief introduction, I've managed to interest you, to get your minds working, which would make me happy, to encourage you to think, and above all, to encourage you to criticize me. But as far as I'm concerned, I've been trying to criticize Hahnemann for 40 years, and I still haven't managed to catch him out. And above all, I hope that this will encourage you to come and join the school. We really need people like you, people who are able to think, able to question themselves, and who, I hope at least, will be able to save society. Thank you for listening to me.